Dr. Isaac Bogosh is an infectious disease specialist with Toronto's University Health Network. We spoke to him on Friday, and he's back to help us tonight with the questions that just keep continuing, Doctor. And let me start with something I saw in the news today and I wondered about. China says the virus's ability to spread is strengthening. That sounds dire. What does it mean?
It's unclear exactly what they mean by that. I mean, certainly we know in some outbreaks, throughout the course of the outbreaks, viruses can change, and they may be referring to the virus having a more easy transmission between human to human, but it's unclear exactly what they mean.
And another definition that I'm looking for an answer to is yesterday in that news conference in Toronto, we kept hearing the case there being described as presumptive.
So that basically means that the initial tests that were done at the provincial health laboratory were positive, and then they were going to send the sample to the national laboratory in Winnipeg for confirmatory testing. We know that yesterday, though, with those positive tests at the provincial health lab, I mean, the microbiologist will kill me for saying this, but really, truly, that was going to be a positive case when it went to Winnipeg. But we still had to call it presumptive until it was actually confirmed.
When we look at the map of the spread of this virus, obviously heavy concentration in Wuhan, in China, but spreading to so many countries, even if it's one case in Toronto and one case in Chicago. But looking at that map also, I think, can give people a sense that we're dealing with something dire here. When you look at the map of the spread, what do you see?
All it tells me is that the burden of illness and the burden of disease in China must be big enough that people are still able to get onto flights and travel to any destination in the world. We've now had several in the United States. We've seen them in Europe, Nepal. Of course, we had our case in Canada. So that the burden of illness and the number of cases in China is large enough that even with 1.4 billion people there are enough people infected with this that they can get on an airplane and land overseas.
The dissemination of information is so critical here, and I'm seeing two currents of criticism. From some people who say you guys in the media are exaggerating the threat here, and from some people who cynically say the medical establishment is trying to keep a lid on this and not giving enough information. Your assessment?
I think it's been, in general, pretty good. Sometimes there's some sensationalist headlines that we've seen or some outlandish claims on social media, but for the most part, it's been really good. And, you know, I'm impressed with the transparency of the Canadian public health officials. We heard yesterday after this case, within a matter of hours, we heard from public health officials at the federal level, at the provincial level, at the city level, at the City of Toronto, and even at the hospital level. So the communication here in Canada has actually been exemplary and very transparent.
And your communication sure is helping as well. Dr. Bogosh, thank you very much.
Thanks for having me.